of formalin in our area come with risks. Exposure should be controlled to keep as low as possible. Exposure can come through inhalation and dermal contact with vapors and liquids during handling. If you smell it, you're already overexposed. Come on, Sonia. A short-term exposure of 15 minutes has an exposure limit of 0.3 parts per million, and our noses don't detect it until it hits 0.5. Health hazards can range from acute to long-term. Acute exposure can cause severe irritation and sensitizing reactions to mucous membranes in skin, resulting in symptoms like coughing, wheezing, and skin redness. Long-term exposure can lead to asthma-like respiratory problems, dermatitis, and, if severe, permanent damage to the immune and central nervous system. Formaldehyde is classified as a human carcinogen and is associated with the development of nasal and blood cancer. Yeah.
Nasal and blood.
Yeah,
Definitely.
probably because you're
Spilled all the
Yeah.
time.
yes,
On my own self.
on my hands.
Yep.
Yeah. Roles and responsibilities for employees handling formalin include participating in training. You're welcome. Understanding the hazards, performing work in line with policies and procedures, including your PPE, reporting incidents, and participating in personal exposure monitoring, which we just did. Thanks to everybody who participated recently, and of course we'll share the results when we get back.
The clippy thing?
Yeah, they just went, the states, it goes to the states and they just let me know that they've received it and they'll be doing their
Oh, I'm excited.
The last few rounds have been pretty good.
They've
for
been all
formalin,
fine. So we do it we're supposed to do it every year, and we haven't had to do it more frequently because our exposures have been within limits.
Good.
All right, controlling exposure with PPE is important. Make sure you're wearing your nitrile gloves and eye protection when receiving specimens into formalin containers. If your hazard assessment leads you to think there's a higher risk of spray, put on a gown in advance to protect yourself. I realize I've never seen anybody do that, but if you have a large specimen,
It's usually going fresh.
and they're dropping it.
Into a 5-gallon bucket.
Unlikely, but it's part of our control plan, okay?
There it is.
Okay.
She's like, I have to say it.
Yes. We understand.
It'll go in a bucket with nothing in it, yeah.
Could you imagine
No, thank you.
No.
Yeah, or was I?
Drop in the bucket.
Okay, yes. Please keep in mind, other people will be handling these items after you. Specimens need to be packaged appropriately for transport. Make sure the tops are tightened, the container is well marked, and standing upright in your biohazard bag with any paper documentation in the outer sleeve, because other people have to use that paperwork after, okay? Outer sleeve. If you're exposed to formalin, there are different procedures to follow based on exposure location. For inhalation, remove yourself or the affected individual to fresh air. This is like a big spill, which you might actually have somebody pass out. I hope that never, ever happens. Yes. Seek medical attention if you've ingested it. For skin contact, immediately flush skin with plenty of water for a minimum of 15 minutes and remove any contaminated clothing.
I'm like,
Not done
Getting
that.
cancer for sure.
Yeah.
definitely
No,
don't.
but you guys, honestly, you need to, yes.
Oh my
Yeah.
God.
Well,
The risk is
I always
real.
wash my hand, but definitely
Please,
not for
please,
Not
15
15
minutes.
soap and water. I know, because you
Yeah.
sneak out, you're the only circulator.
Totally,
Wash your hand
exactly.
off and back you go.
Yeah.
But you saw me pick up the bag that one day.
Oh, I
and I'm
know.
walking,
I
the
talk about
formalin's
that.
dripping,
And
I'm
it's
like,
all
oh my God, and she's like, shit.
from the hallway.
Oh, all the way down
And
the
she's
hall.
like, get over here, put it down, wash your hands, do that. And I'm like, oh, shit.
Yeah, no, you
15
guys.
minutes.
Yeah.
Did not know that.
Didn't know that. Yep.
Sucks right into your skin.
Everybody's hanging over
So
this
what
thing.
about the white crunchy flakes that come off when you take the
Yes.
lid off?
That's a great question.
Very curious about that, actually.
Don't touch those either.
Is that the dried, like when it
It's
dries?
like when it dries, because the lid isn't on
The
properly.
thing is like even if you like open it with gloves, like it's flaking off unless you do it over the garbage can. But then it's in
Dry
the
is better
garbage
than
can.
wet. 'cause
Yeah,
you
I was
wanna-
gonna say, we should probably look at that, cause it probably is better, but yeah, I certainly wouldn't
Yeah.
wanna mess around with it.
And technically, if it's on the floor and they clean it, they wipe it with water.
Yeah.
Like that's its cleaning process anyway. So
Okay.
it's better than the liquid because
Yeah,
you
yeah.
get
Right.
gas vapors off of it too.
Yeah.
Right, yeah.
That makes sense.
But it
So I wouldn't
doesn't sound like-
overthink the.
When you open them, they definitely are crusty.
Yes.
All the time.
Yes.
Yeah.
Like I opened
The
one
big
2
one.
nights
The
ago.
big
big
ones.
one.
I hope
The big
everybody's
ones.
wearing gloves. I
Yes.
have
Yeah,
a
that's the
list of
big
formalin
thing is
containers
wear
that
gloves
have
and
that.
eye protection, right, for sure, and nitrile, well, I think all our gloves are nitrile.
Yeah. Okay. Suggestions, skin contact. 15 minutes. Okay, eye contact. Immediately flush the eye with plenty of water for at least 5 minutes. Everybody knows where the eye wash station is?
Okay.
Pour the bottle
Yes.
over your eyes. It's the scrub sink at 3, in case anybody didn't know that. Didn't want to admit it.
I did know that, actually.
Okay, yes, so you have to use water for 5 minutes. I don't know how you can get 5 minutes worth of water flushing. Maybe go in the shower.
Yeah, you can start with the bottle, shower, and then obviously you're gonna go to emerge too, so they'll flush as well.
Very long time. And then you need to lift your lower and upper lids occasionally. If you're wearing contact lenses, please take them out if possible.
Yes.
Our exposure control plan states all of these exposures should be followed up with immediate medical attention. Which I also think doesn't happen if you get it on your skin.
Definitely not.
As I'm like,
Yeah, literally, I'm like,
wash my hands in 5 minutes.
I got shit to do first. Okay.
Well, yeah, that's it, right?
I'll just stop compressions right now.
Maybe not. All right. Did you know health monitoring is advised for staff handling formalin? Typical symptoms include irritation of skin, eyes, and respiratory tract, headache, nausea, chest tightness or pain, and irregular heartbeats. Employees who work with or around formaldehyde are encouraged to see their
Don't
family
point at me.
physician on a regular basis with an emphasis on examining the mucosa of the eyes, pulmonary system, and skin disorders, along with cancer screening. Yay!
Why do we work here?
Yeah.
It's fun. For the short term.
Okay. Are you guys ready for a tour?
Tour? Yeah. Field trip.